The identification of novel biomarkers to monitor beta cell functioning as an indicator of prediabetes. Principal investigator, Professor Dr. Artur Riduš, AGH, University of Science and Technology. According to data provided by the World Health Organization, an estimated 422 million adults were living with diabetes in 2014, compared to 108 million in 1980. Currently, the number of diabetes patients is believed to be over 500 million and is predicted to increase to 629 million by 2045. Furthermore, the estimated number of undiagnosed sufferers is around 212 million, and 352 million people are at risk of developing type 2 diabetes. Diabetes caused 1.5 million deaths in 2012 and 1.6 million in 2016. Higher than optimal levels of blood glucose caused an additional 2.2 million deaths by increasing the risk of cardiovascular and other diseases. Overt diabetes follows the prediabetes state, which is an intermediate state of hyperglycemia with glycemic parameters above normal but below the diabetes threshold. While the diagnostic criteria of prediabetes are not uniform across various international professional organizations, it remains a state of high risk for developing diabetes with a yearly conversion rate of 5 to 10%. Observational evidence suggests an association between prediabetes and complications of diabetes, such as early nephropathy, small fiber neuropathy, early retinopathy, and the risk of macrovascular disease. Several studies have shown the efficacy of lifestyle interventions with regards to diabetes prevention, with a relative risk reduction of 40 to 70% in adults with prediabetes. The prediabetes leads to type 1 and type 2 diabetes mellitus in general. In both types, the elevated blood glucose is the result of inadequate levels of plasma insulin, which is produced and secreted by pancreatic beta cells. The total amount of insulin released depends on the absolute number of beta cells in the pancreatic islets of Langerhans, beta cell mass, and the output of each of these cells, beta cell function. It must be underlined that pancreatic beta cells are the only cells that secrete insulin in response to elevated blood glucose levels. Therefore, the ultimate goal of the project is to discover biomarkers for monitoring beta cell function as a prediabetes indicator through the utilization of non-invasive methods, preDIABs. The main goal of the project is to conduct fundamental research focused on the identification of biomarkers indicating prediabetes through the monitoring of beta cell functioning. The objectives of the project are summarized as follows. Objective 1. The fabrication of a multi-organ on-chip device integrating the pancreas, the liver, and the respiratory tract. Objective 2. The identification of novel biomarkers to monitor beta cell functioning with the utilization of non-invasive gas sensing analysis in vitro studies. Objective 3. Defining the generation of biomarkers in pancreatic beta cells and hepatic cells. Objective 4. The identification of the possible pathway of the biomarkers from origin to exhaled breath. Analysis of artificial exhaled breath composition in vitro studies. Objective 5. The identification of novel biomarkers to monitor beta cell function in the exhaled human breath in vivo studies. Objective 6. Analysis of the identified biomarkers in terms of prediabetes prediction. Objective 7. Analysis of the possibility to develop the nanostructured-based gas sensors for detection of the identified biomarkers. Proof of concept of the multi-organ on-chip system for indicating prediabetes. For the first time, a multi-organ on-chip device combining the liver on-chip, the pancreatic on-chip, and the respiratory on-chip elements will be fabricated, that is, three-dimensional engineered pancreatic islets tissue with engineered three-dimensional hepatic spheroids and lungs, bronchioles, alveoli, trachea, larynx duct in conjunction with gas-sensing modules. Such realization allows researchers to study in vitro the biological path of the released biomarkers from the pancreatic and hepatic cells via the respiratory system to the exhaled breath. Finally, the developed multi-organ on-chip device allows researchers to identify the biomarkers of prediabetes and pre-non-alcoholic fatty liver disease in the exhaled human breath. Furthermore, the in vitro studies are to be supported by the in vivo analysis of the exhaled breath from both patients and healthy volunteers. The current literature suggests that beta cell mass and function contribute in different ways to the development of type 1 and type 2 diabetes. In both types, the elevated blood glucose is the result of inadequate levels of plasma insulin, which is produced and secreted by pancreatic beta cells. It has to be underlined that pancreatic beta cells are the only cells that secrete insulin in response to elevated blood glucose level. The more we know about the beta cells, the better equipped we are to solve issues associated with the decreasing of beta cell mass and beta cell functioning. In type 1 diabetes, the pre-diabetic phase seems to be characterized by a prolonged, gradual functional impairment, followed by a rapid decline in beta cell mass just before the onset of hyperglycemia. By contrast, in type 2 diabetes, there is a lack of cessation of morphological and functional beta cell compensation in response to an elevated insulin demand during insulin resistance. Therefore, the protection and recovery of beta cell functioning should be a main treatment and prevention target in both types. At the time of diagnosis, 80 to 90% of beta cell mass has already been lost, and it is generally accepted that it would be extremely difficult to intervene or reverse the progression of the disease at this late stage. However, the difference between type 1 and type 2 comes from the natural progression of diabetes, which is months for type 1, while for type 2 it begins from 5 to 10 years prior to the actual diagnosis. Therefore, it is crucial to develop a method that enables determining the occurrence of the pre-diabetes state, as it gives the highest possibility to prevent overt diabetes. The same observation applies for non-alcoholic fatty liver disease, which is a kind of clinical pathological syndrome characterized by the excess deposition of fat on the liver, which is caused by an imbalance between hepatic synthesis and the breakdown of fats, as well as free fatty acid storage and disposal. In most patients, the development of NAFLD takes years, and the results from the interplay of several risk factors like overnutrition and/or an inappropriate dietary pattern, as well as inadequate energy expenditure due to a sedentary lifestyle and the likelihood of genetic susceptibility. NAFLD can progress from hepatic steatosis to steatohepatitis, resulting in an increased susceptibility of cirrhosis and hepatocellular carcinoma. The identification of biomarkers that could serve as indicators of the above-mentioned changes will be beneficial in terms of the pre-NAFLD state, as well as prediabetes. To achieve this goal, a multi-organ on-chip device combining the liver on-chip, pancreatic on-chip, and the respiratory on-chip elements are to be fabricated in conjunction with gas-sensing modules. The gas-sensing probe is to be equipped with several detection techniques to analyze the possibility of detecting biomarkers in their origin, that is, in the pancreatic and hepatic environment, and the further biological paths from the origin via a respiratory duct to exhaled breath. Therefore, the fabricated multi-organ on-chip device allows me to analyze the progress of the biomarker route at every crucial step and to perform the gas-sensing analysis with several techniques such as Raman spectroscopy, Fourier transform infrared spectroscopy, and proton transfer reaction mass spectrometry. To achieve this objective, the artificial exhaled breath will be collected where various states of diabetes and pre-diabetes, as well as NAFLD and pre-NAFLD, will be simulated thanks to in vitro cell studies. The exhaled breath analysis from artificial exhaled breath samples will be validated using the exhaled breath analysis from the human samples taken from patients suffering from non-alcoholic fatty liver diseases and diabetes. Therefore, it allows me to conduct the comparative analysis and formulate the group of biomarkers that are adequate to monitor beta cell function. It has to be underlined that the high risk and high gain effect lies in these two objectives. First of all, if successful, the project outcomes will open a new research field with a potential clinical application with a fully non-invasive screening test for civilization diseases, and it can be expanded beyond diabetes and NAFLD. At the same time, there is a high risk that the detected biomarkers in their origin will react, and they will either not be present in the exhaled breath composition or will be present in extremely low concentrations that are below the limit of detection for the proposed methods. To reduce the risks associated with the limit of detection, the recently launched proton transfer reaction mass spectrometry instrument is planned to be purchased, and this has a detection limit below 0.1 part per trillion, a sensitivity level above 50,000, and a mass resolution of over 12,000. Moreover, the multi-organ on-chip device allows us to analyze the biological path of the biomarkers, and we should therefore be able to detect the route from the origin to the exhaled breath, as well as monitor the possible biological reactions in the respiratory tract. During the in vivo studies, aside from the exhaled breath samples, blood samples will be analyzed according to the protocol of the clinical trial previously registered in the European Union Clinical Trials Register. Finally, I will test the proof of concept of the screening platform equipped with a dedicated gas sensing module based on the cheap nanostructured gas sensors, wireless connection and telemedicine modules with the software application for subjects and clinicians.